Welcome to Real Talk, where we skip the gimmicks and get honest about what's really happening in your body and what to do about it. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor.
And I'm your co host, Gerardo Ortega. Today, we're talking about something that hits home for so many people: the difference between integrative health and conventional medicine.
Reminder, this podcast for informational and educational purposes only. We do not diagnose, cure, or treat any illness or disease. Now, if you ever been to the doctor, had your labs come back as normal, but still felt terrible, you're not alone. Or maybe you're handed a prescription, but no one asks you about your sleep, stress, diet, or toxic load. That's the gap we're talking about today. What is integrative health? What is conventional medicine really set up to do? And what happens when you start asking better questions about how to support your body, not just patch it up? In this episode, we're digging into the difference in philosophy and goals between the two approaches, how each system interprets labs and symptoms, why prescriptions and protocols aren't enemies, and when each is appropriate. What to expect from integrative care in terms of time, money, and mindset. Because understanding your options is the first step towards better outcomes. So let's get real.
Yeah, man, there's a huge difference right now from integrated health versus conventional medicine. It all depends on what's going on, who's taking care of you, and how worried are you right now with your current health. You and I have been preaching to people as much as we can do the holistic route, take your supplements, or some of the people out there is just, nope, I'm sticking to whatever my doctor's prescribing me as far as antidepressants for the anxiety, for all that stuff. But these are the ones that might be cooped up inside or have a desk job and they're not out there moving around.
I don't think people know the difference. And I think people were raised, a doctor's there to heal you, and they just solely rely on their doctor and they don't educate themselves on other methods. But again, you have to be your own advocate. You can't just rely on a medical doctor. You need to take this, you need to do this. This is best for your body because you, as an individual, it's not always best for you. And
Exactly. You are the one that knows the body the most. If you have an ache somewhere, just keep an eye on it. Just make sure that it's not going to escalate to something severe in a couple of days. If it's gone in a couple of days, then your body healed itself. But if it's still there and it's bothering you, say something, do something about it.
and that's where people need to learn their own body and know what to say to a doctor and not be afraid of their doctor. I think many people are just afraid of their doctors.
And honestly, I think you go in there, you get your checkup, the doctors are talking to you about everything. How are you working out? Have you gotten blood work? And then they'll ask you, you got anything else for me? You want to ask me any other questions? And at that point, either you're overwhelmed because you already waited half an hour for them to come into the room and you just want to get out of there. At that point, a lot of people, they'll just say, I'm all right. There's nothing else. But, you take your wife to the appointment with you and she's going to have a whole list. Oh, yeah, this day he was complaining about this. He's also hurting on this, but it's just us being on the spot. I don't know if every person's out there like that, but I know many are.
If I go to a medical doctor, they're like, man, when could this guy leave and stop asking questions?
And that is true just because on what you've learned, or I guess I could say what we've learned so far, and it's like now we're asking the correct questions.
So let's start with one of the most overlooked but most important differences in how we approach health. What is the goal of the system that you are using? Conventional medicine is built around diagnosing and treating disease. It excels when there's an emergency. Think about it. If you break a bone, get appendicitis, develop pneumonia, have a heart attack, you want fast, structured, evidence-based care. It's common sense. You want someone who can stabilize you and save your life. That's sick care. We absolutely need it. What do you think?
Yes, for stuff like that, and I've said it before, if it's stuff that's medical, and that's when I praise the modern medicine.
You have a heart attack, you have any of these things, you want to see a doctor. But that's when conventional medicine often stops. It's reactive, not preventative. And for a lot of people, their health issues don't fall into emergency category. Instead, they're dealing with low energy, mood swings, digestive issues, hormone imbalances, sleep problems, chronic inflammation. They aren't dramatic enough to send you to a hospital, but they're impacting your daily life. And conventional medicine doesn't always have a clear path forward for that. And I think that's where people do not understand a lot about integrative health. They just think of these things and think, oh, my doctor's doing that already. And your doctor does not do what we do.
I think one of the biggest things is when people get sick, it all depends if you're moody, if you're actually coming down with a cold, or you just don't feel good because the stress levels could be up, you got low energy, you're fatigued, you got the mood swings, like you said. But it's just some people think they're okay and that's how their body's supposed to run, and that is not how it's supposed to run. You want to be running at your optimal level. And that's what I'm learning now. And me personally, I feel like I am running now that way, like a lot better than I was in the past year. It's just getting after it and not just putting a band-aid over your health issues. I got a headache right now. Let me take a Tylenol. Tomorrow, the same thing. Try to figure out why you got the headache in the first place. It's just people shouldn't wait to the last minute.
People wait until the last minute to cover their health, but also people not knowing the difference of, again, what a medical doctor does and what they should do. And a medical doctor there, they're trying their best, but they have a specialty of what they do, right? You get knee pain, they give you medicine for your knee. They don't look at the root cause. They're never going to do any of that stuff. So people got to stop thinking their doctor's going to heal them because that's not what a medical doctor does.
They're there to have a script of what they've learned, not what's out there, what's modern right now, what's truly helping the people.
That and a lot of medical doctors don't do any research. They just go based on this is what insurance covers, this is what I test for. And then other doctors are more learning integrative stuff and saying, you know what, I'm going to research this, or at least here's information for you. You go home, research if you want to take this medicine and the side effects, and if there's other avenues for you. But you do that. You be your own advocate. And some doctors are stepping in for patients, but it's rare. So it's one of those things people need to learn. What does conventional medicine do and what are they not doing? And that's what we're going to talk about more. That's where integrative health comes in. Again, we're not about replacing conventional care. It's about filling the gap it leaves behind. And a lot of people do not know there's a gap. That's what we're trying to communicate out there.
I might have said this before, but we should put like a panel up pretty much saying, hey, you do an ashwagandha, these are the side effects. I know what they are, but people don't. Versus an actual either a Xanax or even a like an antidepressant and put them next to each other. The side effects of those two versus ashwagandha. But people don't know. And that's what we're here to teach and spread the word, spread the awareness.
The key is education. And the difference where a lot of people may not like supplements is because a lot of people want a quick fix, right? You get the people that says, hey, you're type 2 diabetic. Your options are to eat better or eat bad, still eat McDonald's every day, but you could take an insulin injection. What do you want to do?
Oh,
Most people say, I just want the injection because they want to eat bad. So you have the option, just like with certain supplements. Say you do take ashwagandha for anxiety or whatever, B-complex. Say you're taking that, it might take more weeks to get into your system, get blood levels up for it to work for you. Specifically, depends on your nutrition and stuff versus them taking a Xanax that works in 15 minutes.
Of course.
So it's one of those things, people like a quick fix, but what does that do to you long-term, your health? Now you need double your dose. Now you need multiple depression medicines because you're not fixing the actual root issue. And that root issue, maybe it's a brain chemical, right? Maybe it's serotonin, dopamine. Maybe it's you're missing B nutrients in your body. Maybe you have that gene that you can't process folate and stuff like that. There's a lot of different gaps out there that people aren't aware of, but they need to take that step to do functional labs to understand, oh, this is why I have these symptoms. This is why I have these mood swings. My doctor may have gave me Xanax when in reality, I was low on B vitamins and my diet was horrible. Now I fix this. Now I feel much better. I don't need Xanax. But, or their hormones are off or their thyroid's off and their doctor's just saying, oh, you're depressed. And what caused the depression? Is it trauma, right? Or is it deficiencies? You have to look into that. And that's where integrative health, we focus more on being proactive. It's system-based. It's not waiting for a diagnosis. It's looking at the root cause of the dysfunction before it becomes diagnosis. The entire focus shifts for what can we do about this to why is this even happening? As we always say, it's not a one-size-fits-all. It's not a single solution for everyone with fatigue or joint pain. It's about understanding the story behind the symptoms. For example, let's say someone comes in with fatigue. In conventional care, you might check the thyroid or iron levels, and if those look okay, that's it. But in integrative care, we ask, are they eating enough real food with micronutrients? Are they absorbing what they eat? Or is there a gut dysfunction? Are their mitochondria, your cellular energy engines, are they underperforming? Are they under chronic stress or burnout that flatten their cortisol rhythm? Do they have hidden toxic load from mold, heavy metals, or plastics? All these things that a medical doctor will not ask.
Oh, and not only that, on the line of work that I do, it's all physical. We're outside. We're in the conditions. If many of y'all don't know, I'm a mailman. We're walking all the time. I personally rather be walking than being stuck in a toaster oven. bacon as I deliver mail. Some that I do talk and some that I don't talk to as carriers, they're running low on energy. They're just running on fumes. They're drinking energy drinks just to get that boost up. Why are they settling to just be all right and running fatigue? I'm not preaching to anybody about their health or anything at work. They're starting to know what I'm up to and what I'm doing here with Mindful. And some do ask questions, and to the best of my ability, I'll give them not recommendations, but I will do like suggestions for them. Some take them, some don't. If there's something wrong, do not put a band-aid on it.
It's people got to educate themselves. I think that the big thing would be research, but the downside of certain research is Dr. Google.
Oh
People
my gosh.
people use Dr. Google, and then that leads to you cut the tip of your finger, and next thing you know, you have HIV and cancer
Yep.
from the pain in your finger.
That sounds about right. Yeah.
So it's easy to become a hypochondriac at that point because all your symptoms overlap with every other diagnosis out there. So again, we do not diagnose or treat any illness or disease, but on that side of things is what's the root cause of these issues you're having? Again, the knee pain, if you took a hammer to the knee, you know what's causing it. You need to
Exactly.
go hospital. But is your knee pain because you walk all the time? Okay. Is it actual issue with your knee or is it inflammation? You go to a medical doctor, oh yeah, take ibuprofen, you need a knee replacement surgery.
Oof.
Then it will come to us. It's let's run these labs. You have high inflammation. Let's address that. Proper nutrition, omega-3s, so forth.
Yes.
And next thing, a couple months go by, they're like, hey, my knee's not cracking anymore. Hey, my knees feel great. Thank God I did not go and get a knee replacement.
I like to say that I am guilty for that. Now, being a mailman for 10 years, I would get off the couch and my knees would just pop and crackle. But now with the supplements, staying on the actual program, doing them every single night, I don't notice that much the back pain anymore, the knee pain, the hip pain, the ankle pain. I'm good. I'm running way better now than I
Yeah.
was.
Plus, I think you addressing your nutrition, eating more. That's gonna be a
That
big
no,
key.
that it's I know now it's man, like I'm eating way more than I'm ever used to, but I'm feeling better. I'm feeling great. The hot days currently right now, they're not affecting me as much as they would before.
Another big shift is the tools we use. In conventional care, you mostly work on prescriptions, procedures, referrals. Integrative care, we use functional lab testing, clinical grade supplements, nutritional therapy, breath work and nervous system support, detox strategies, gut healing protocols, sleep and movement tracking. How often have you been to your medical doctor and they're like, oh, yeah, let's run functional labs or let's use these clinical grade supplements or let's work on your nervous system and breath work? You never hear that from
Nope.
in conventional
Do the
medicine.
box breathing. It's all that. They would never take that approach. They rather give you a prescription, take it. If you don't like it, come back. We'll switch it to a different one. Not know. Let's try the holistic way. They never do that.
And maybe more importantly, it's not treatment, it's education.
Yeah.
And that's what we do. That's why we have in these podcasts free information. Utilize as much free information as you can. And the one thing we always say food tracking. It's one of those things. It's easy, it's free, right? Start tracking your food, and then you realize, oh man, I can't believe what I'm eating or what I'm not eating.
No, exactly. To episode 39, how you were saying, it's I know a lot of people think I'm gonna eat less, walk more, I'm gonna lose weight. No, it's not like that. You need to eat a well-balanced diet. And for me, I feel like I'm eating more, cleaner, and me personally, I'm at a good weight right now. Would I like to put on muscle? Yeah, but eventually I'll get to the gym.
It's one of those things where people always assume starve yourself, you lose weight. And I was in that mindset too for a long time, years and years. A lot of diet pills, a lot of all that, struggling with weight until I learned a lot of this stuff. And then when you think there is that good book out there, I don't know why I never think of the author's name, but Eat for Energy. But same, even in that book, just based on research, the information shows you need to eat for energy. And people that start eating and eating properly, they drop weight. And if you're skinny already, at times you start packing on muscle or you start toning up, especially if you're skinny fat and stuff, you start toning up because you're eating more and properly. And the big thing, they say if you want to really lose weight and look good and stuff, eat, obviously we always say too, is eat protein with every meal, but get out there and have like protein and vegetables, which chicken maybe in the morning or afternoon or however you do it, or protein shake, whatever. But have, say, chicken breast and then a small bowl of vegetables, small plate of vegetables. And then dinner time, have steak and a little bit of vegetables or chicken and vegetables. They say if you want to get lean, you eat chicken turkey as your meat source. If you want to gain muscle or gain weight in that sense, eat red meat.
Oh,
But
yeah.
but the key is eating.
Yeah.
And a lot of people think, oh, I need to stop eating to lose weight. That's why I said, you know what? Again, calories aren't always the enemy. Track your food and see if you're eating enough and see what you are eating, because people do not realize what they do eat until they track them. Oh, I didn't know I had that much chips this week. Oh, I didn't know I drank that much pop this week. They do not know until they track it. Then it opens up their eyes and says, oh, this is why I'm not losing weight. Or your issue, I'm losing too much weight and I'm not gaining. Well, once you start tracking your calories, oh, I'm eating 1,500. I need to eat 3,000. I did not realize that till I tracked.
And that was me eating 1,500, having a lot of food during my work shift, being at home. I was not eating enough. Now I feel like I'm eating too much, but I'm okay because I feel good. My gut feels a lot better. I know I'm finally taking care of my body how it's meant to be.
Yeah, and it's hard to build a good relationship with food. And sometimes it's hard to eat enough calories.
Yeah.
But that's when you have to say, okay, how much is this bowl of rice versus this chicken breast? I'm getting a lot more calories, or, vice versa. I'm getting more protein by eating that chicken breast. Maybe I don't need to eat that rice because of the amount of calories in there. Or maybe I need to increase certain things. Like maybe I need to eat rice because I'm missing so many calories.
Yeah.
Or I'm not getting enough carbs. And all these people are into that mindset of the kind of Atkins way of no carbs. Carbs are bad for you. Where does that lead long term? It's too hard. Just if you went strictly hardcore carnivore diet,
Jeez, yeah.
yes, you could do that, lose weight, tone up and everything in a month or two. But how do you do that over 10 years, eating just meat all the time?
No.
Same. How do you do eating no carbs all the time? It's impossible. So you have to balance out your nutrition, and there's just more gaps in your nutrition, and you end up with more deficiencies because you switch to this like fad diet and now you threw your whole body off.
No.
So we're not here to fix you, all right? We're here to help you understand how your body works, how your choices impact it, and how you support you in real time. You're no longer just a patient. You're a participant.
Yeah. It's just for those out there that are listening. If something hurts, something's bothering you, if there's an ache, do something about it. Don't just try to stick it, just hold off on it. If it's bothering you enough, it may or may not come back. Just keep an eye on it. Just be aware of what's happening to your body. I know this whole process with changing with your body diet and taking care of your body, taking supplements, is not an overnight thing. This is a process that I would recommend everybody to get on if they can.
We said, when's your health important to you? People wait to the last minute or when they're really sick, but why be reactive? Be proactive, have a long, healthy life, enjoy your everyday, feel good daily, and don't just focus on, oh, I feel okay. Now I'm in a constant pain this day and this
Oh.
day. I'm not sure if you heard the other real talk just with Burn on there, but like we were talking too, it's so many people like to complain about their health issues. And you would think, here's a card. Why don't you do something about it? Here's contact information. Here's free information. You could go to the website, download different shopping lists, all that stuff too. But then we look, wasn't this person just complaining they don't know what to buy or how to read a food label? But the free resources are out there and they're not taking advantage of that. So it makes you wonder, do people really care about their health?
They only care about their health when something is truly bothering them. If it's not bothering them, it's just one of those things that's out of sight, out of mind. But not until something is really wrong with them. And integrative health is not going to be their first option because they want a quick fix now.
No.
But why go that route when you could start taking the preventative maintenance right now to avoid any long-term issues?
Why let it get bad? Okay, you're gaining a lot of weight and you don't know why. Is it because you're on anxiety medicine? Is it because you're on birth control? It's because your diet's wrong. Is it because your thyroid's bad? And then you always hear, did you run labs? Oh yeah, my doctor ran all labs and said everything's good. Let me see those labs. These labs don't show anything. The doctor didn't run anything. Oh, I didn't know that. So now there's different avenues. There's a lot of research out there. There's a lot of podcasts out there that says, hey, you know what? Check this. Check your gut. If you have bacterial overgrowth, check you're having hip issues and stuff. Was it the mattress you're laying on? Did you go to a chiropractor? Oh no, I just went to my medical doctor and he just ran basic blood work and he said, Everything's good. I was like, they didn't look for inflammation. They didn't look for any of this stuff. Are you interested in that? Oh, yeah, I want to do that. And then they never do it.
No, yeah. I think that's for everybody.
But you either care or you don't.
Exactly. And then not to mention, yes, we are giving free information, recommendations, but it's just one of those things. Don't wait till something's truly wrong. And there might not be nothing wrong with you right now, but who knows in a couple days.
And as we're talking, the thing that causes a lot of frustration in people is the lab results. Because how many times I know someone felt awful, they got their labs done by their medical doctor, and their doctor said everything looks normal. The word normal, that's misleading. And conventional medicine lab results are interpreted using reference ranges. If those values fall inside that range, you're typically told everything's fine. But here's what most people don't know is those ranges are based on population averages, not optimal health. And again, like we always talk, we want to get people to optimal, not just feel okay. And a lot of people don't know there's optimal. They only know okay.
Jeez, it's awful. And it's awful to hear when you're fine from the doctor when you know you're not. And that's just because they're not going in deeper into the blood test. They're only doing just the basics, not what's really bothering you.
Especially if you are in a lot of pain or you have a lot of issues and your doctor tells you everything's normal. That's why I think people get frustrated with medical doctors. Everything looks fine on the labs. Oh, people complain my stomach still hurts. Okay, well, see a specialist. Why do they tell you see a specialist? One, they either don't know that avenue or the pain or how to handle that, or they just got to the point where I'm tired of dealing with this person. Let's dump them off on somebody else.
Yeah. My recommendation would be, am I okay? Should it be all right that I feel this way, even though my numbers say that they're normal? If you don't feel normal, you got to make it known to them for them to look a little deeper, and they might not even have an answer for you. And if you happen to reach out to us, you'll get better answers.
Yep, because we look more at that root cause. All these regular conventional labs, they include people who are already dealing with chronic illness, inflammation, obesity, and early stage diseases. So being normal just means that you're not in the bottom 2.5% or the top 2.5% of the sickest people tested. It's not good information. That's why we look at individualized labs for optimal levels.
All the people that I know right now are really, like they're all my coworkers. I've worked with them since I've been there for 10 plus years now. Some would tell me, oh, yeah, I'm fine. I got my blood labs back and I'm okay. They might be told that they're okay, but it's just one of those things that I know they could be doing better.
Say we look at functional labs versus conventional. A medical doctor runs basic conventional labs. You come back normal because you don't have specific disease or, something wrong at that point. And then over a course of 10 years, you go back to the doctor, they run labs again and say, oh man, you know what? You're having all these issues. Your blood's really thick. All these years, you could have prevented that because by running functional labs, we could see, hey, there's an issue here, or hey, there's a imbalance here. It's going to lead into this thickening of blood. You should take this action now. And they're not going to see it until it's too late. And that's where the medical doctor, conventional medicine, they're not going to know until you actually have that disease.
Exactly. And the medical doctor is only looking for an issue, not what could occur in a couple of months, in a year. They're only fixing you, whatever's wrong with you right now.
Yep. High blood pressure, take a pill. When in reality, maybe berbeриne's what you need. Maybe it's insulin issue.
Berberine is such a beautiful supplement because from your previous pod, hopefully people caught that one too, as far as glucose stabilizer. But it's a healthier fat loss pill, technically.
Oh, yeah. A lot of people use it for weight loss. And I think there's a big disconnect, right, between conventional and integrative care. Integrative health, we look for that optimal range, not just a range, but that optimal levels. We also consider the pattern of the labs over time, not just a snapshot, right? That medical doctor pulls in and said, here's a snapshot. This is where you are at this current state, like you're saying. And we ask how your symptoms line up with what we're seeing. Because at the end of the day, you're not a number, you're a story. Here are some quick examples of what we often see. TSH, thyroid hormone of 4.0, might technically be normal, but from someone dealing with fatigue, brain fog, and hair thinning, that is not optimal. We look something closer to 1 to 2 range. So conventional medicine, right, looking at 4.0 range and saying you're normal, but we're looking at that 1 to 2 range. Big difference there. B12 levels of 350 may pass via conventional test. Your medical doctor may say you're fine, but you could still have anxiety and poor memory with low levels. Cortisol might appear fine in a single blood test, but your daily rhythm, especially morning energy, can still be totally off. And that's one I hear always about. Everybody's, oh, it's my cortisol. Why is your cortisol out of whack?
And that is a trendy word at the moment right now. Like everybody, you cannot go a day without not hearing it on social media. Now, let me ask you this. I'm sorry to put you on the spot. Anybody that has thyroid issues, what is a supplement package that you would
Um,
suggest?
One is, why is their thyroid off?
Okay.
We gotta look at that, right? Is it because they're on medications? Is it because they are diabetic? Is it because of they have thyroid condition? There's different things. Like there's different supplements, zinc, selenium, iodine, stuff like that. If you're not sure and you take like excess iodine and stuff, it could really damage your levels and damage your thyroid and stuff too. So you got to know what to supplement with. But there are thyroid complexes out there. I think Pure, Thorne, many of them make thyroid complex where it has the proper nutrients for your thyroid. But again, we want to look at that root cause before people blindly take selenium and iodine and stuff to find out, hey, you're having this issue because of this.
What can the people take to protect their thyroid?
From nuclear, well,
Yeah,
iodine.
okay, but just say myself, as what I know right now, where I currently sit and record with you, I know I have no issues with my thyroid.
I would just say initially would be that multivitamin
Okay.
that has selenium, iodine, zinc, all that in there. It might not be a therapeutic dosage that you need specifically. So say you take a multivitamin, say you do have thyroid issues or your thyroid's a little slow, you may need additional selenium, you may need more zinc, you may need
Got it.
D3 and all that. Again, at least start off with the multivitamin to get you on that foundational approach to understand, okay, I'm fulfilling specific gaps in my diet with this multivitamin. Now let's see if I improve over a course of 4 weeks, 5 weeks, 6 weeks. Maybe I need additional. And then we go from there. But same, you could run labs beforehand. This is my thyroid. This is my deficiencies. Take a multivitamin, run labs again and said, hey, this was enough to improve my thyroid. Now it's optimal ranges.
Pinpoint the problem right away.
Oh, yeah. Lab tests are great for any of that stuff. And this is why integrative providers use additional labs. They aren't part of standard panels, not because we're trying to find something wrong, but because we're trying to understand the full picture. And I think that's what people think a medical doctor does, look at the full picture.
They only get a quarter of the picture.
Oh, yeah. Your stomach issues, do this scope.
Gosh.
What did they check? Do you have candida? Do you have H. pylori? Do you have all these things wrong with you? And that's causing the bloating and stuff. Or do you truly have stomach cancer? What is it?
Yeah.
And you know what? They did a scope, your stomach's fine, and then you're still in severe pain every day. What did that $5,000 bill bring you? They did a scope. What's the risk of them doing a scope? Now, do you have to worry about cancer, colon cancer and stuff because they did the scope and down your throat and all that? Do you have to worry about throat cancer because they damaged your throat lining?
Yep.
Because they ran a test like that? When in reality, you had bacterial overgrowth in the gut and it could have $300-$400 test could have saved you thousands and thousands of dollars. Not only thousands, but long-term risk of developing some kind of cancer.
Exactly. You don't know what kind of tissue they're tearing up from whatever end they're going in through, your mouth or the bottom. And
Heard so many horror stories.
exactly. So it's just not even to get too deep into that, no pun intended, but it's just,
Maybe some people like the scope.
yeah, I don't know, maybe, but it's just do your own research on that part. If it's something that you're going to get done eventually, there's other ways to test.
Yeah.
Not through an actual probe testing.
Yeah. No need to be a victim of a alien abduction.
Exactly.
Yeah, so we might run the common one we always say organic acid test to look at nutrient processing, gut imbalances, and micronutrient mitochondrial function, a GI map to uncover bacterial overgrowth, parasites, and inflammation in the gut, a Dutch test for that 24-hour view of hormone and cortisol panels. The great one, which was a good test, was food sensitivity panels to catch immune reactions not picked up by allergy tests. The mycotoxin and heavy metals panels to see if toxins are derailing energy, focus, immunity. The heavy metals are a big one out there a lot of people don't know about, and their medical doctor never brings up heavy metals, but it's testing a lot of people. You see everybody with high mercury, high aluminum, but it leads to fatigue, mental issues. It could lead to dementia. There's so many things because of heavy metals. Is it in your soap? Is it in your shampoo? Is it in the food you eat?
Now, let me ask you this. Do you think people ever get surprised by what all these deeper tests reveal?
Everyone. Think of you back with just food sensitivity
Yes.
tests. You look at that, I'm good on food, like certain things, dairy,
Yes.
but other things, you're like, I can't believe this. I can't have green tea. This is crazy. Or
No.
I can't have bread. What
Yeah,
is going
no,
on?
that's all that has been an eye opener for me. I went from eating wheat bread for so many years that I made the switch over to a cleaner white bread, and I feel fine. I feel good. I eat it every day and I've been okay. I feel fine. I feel okay. It's like my body hasn't quite shifted to the negative. So as of right now, I'm keeping it. But if I start noticing changes in my inner body, then that's when I start moving things around. Or I'll wait to the half year mark and get retested again to see if whatever I did these past 6 months have helped me, or did I make it worse by eating something different?
You look at the food sensitivity test, easy test to run, and it opens up a lot of eyes. That and organic acid test. But you look at so many people like, oh, I have an allergy for gluten. So who told you that? The doctor. Okay, doctor told you that. You have allergy for gluten, so you eliminate everything gluten. Then we run a food sensitivity test because they haven't been eating gluten for a couple of years. Oh yeah, I feel fine, but you look at the whole picture. How'd you eliminate gluten? I gave up bread. I gave up all these different things, cookies, whatever. Then we run the food sensitivity test and find out they don't have a sensitivity to gluten. They have a sensitivity to like the meat glue. If they got rid of certain products anyway, they would have had no issues. But they gave up gluten for all these years and it wasn't even an issue with gluten specifically.
Gosh.
There's different things out there like the different parts of gluten, of what makes up gluten, they could have a sensitivity to, but the gluten itself, they were fine with. You don't know until you test and then you see this and you're like, wow, I did not know that.
Just speak about not knowing. Think about the people that go to their doctor, get their regular test, come to us, get an actual in-depth blood work panel. Some might get confused just because my regular doctor said I'm fine, but you guys are telling me that these are some of the deficiencies that I have. How come my doctor didn't tell me that? Because they're not looking for that. They just want to make sure that your basic bloodline is all right. And they're not looking in deeper.
I tell people in that scenario, oh, you went to your medical doctor, said you're fine. You went to your medical doctor and your medical doctor said you're fine in general, right? And then you're still having all the stomach pain stuff too. The other side is doctors have their specialties. Our specialty is looking for the root cause. If you have a heart attack, you're going to a medical doctor, you're going hospital, car accident. But day-to-day care, you do not use a medical doctor for that. That's where integrative care comes. Be proactive, run the labs. And it's not about running every test on our son. It's about the right test based on your symptoms and history. Medical doctor, oh, let's run this, let's do these MRIs, let's do a CT scan of this, let's do the scope.
Exactly. Yeah. And for me, honestly, it's like I wonder how often are the doctors studying or even looking into these newer tests? They're only like me personally, I guess good thing I'm not a medical doctor, but if I was and I spent so many and I sacrificed so many years studying and spending long nights and maybe messed up a couple relationships because you were too busy studying. Once you're in the field, I don't think people are growing anymore. They know what they know, and that's that.
Yeah, why would you? When you have 100 patients a day,
Yep.
you're making money off every test you send them for. You're getting commission back from pharmaceuticals you prescribe them.
Exactly.
You're getting kickback from the vaccinations you give them. Why would you need to study when you're so full and busy as is over the 5 things you specialize in of chest infection, sore throat, this? You're doing that every day, all day long. Why do you need to learn anything different? Why would you do research if you're a medical doctor?
Gosh, no, it's yeah, that's the crappy part about it, to be honest. It's just they know what they know, and that's that. They didn't pay for any additional. They already might have a hefty bill for schooling. They're not gonna go back to the drawing board just to learn a whole new set of testings.
Yeah, they have no reason to. And when you go to your medical doctor, and again, there's a lot of good doctors out there. Say you go to your medical doctor and it's like, when was the last time you looked at peer-reviewed research on this pharmaceutical or this cancer research? A big one out there everybody is suggesting, fembenzoyl and ivermectin for cancer treatment, for fixing pimples, rosacea, for all these things. People are using ivermectin, all this stuff too. Go to your family practitioner. Hey, can ivermectin do this? No, it can't. Okay, but the research says it can. Do you not look at the research? No, I don't have time. That makes sense because you're just diagnosing sore throat, pneumonia, chest x-ray. You have an issue, people low testosterone. They say, okay, you're fine for your age, low testosterone, or no, go to a urologist or go to a clinic and deal with that. But I don't have time. I'm not going to research why you're low on testosterone. None of that stuff. No fault to the medical providers out there. It's just what they do and what they specialize in and what specialists specialize in and what integrative health does. Like, it's totally different. That's why I said nobody's to blame. It's just different avenues, and we're here to educate people on the difference.
Exactly.
You don't go buy a new car and you go to Meyer to pick that up, right? You're going to go to
You
a
go
car
to a
dealer and stuff.
specialist. Yeah.
Yeah. So same thing. You're not going to go to a medical doctor and say, okay, what's the root cause of my hip issue? What's the root cause of my stomach bloating? They are not going to research or know that. They're going to maybe send you to a specialist that might say, the only options, we don't look at gut bacteria, but we'll run a scope to see if you have cancer. And then if you don't, there's nothing wrong. Okay, I don't know. I'll send you home and you got to deal with it. You're okay.
They're just going to go in there, look, hey, it looks fine.
Yeah, they don't run any stool tests for, oh, you have parasites. They don't look for any of that. So what we're after is context. If someone's tired, anxious, and inflamed and their standard labs show nothing, it doesn't mean nothing's wrong. It means you haven't looked at the right places yet, just like we're saying. That's the key. Symptoms often show up years before disease does. We want to catch those early whispers instead of waiting till your body's screaming. And like we said with the labs, if you keep running and it's normal, you know there's something not right, you got to look further into it.
All right, Doc. I got one for you. Which 2 or 3 tests someone should prioritize if they're on a budget?
Step 1, I would say, start food tracking. This way you're not wasting money. You're not talking to a practitioner. You're able to identify a lot of issues up front. Food sensitivity test would be a second one. So track your food for free. Identify if you need to eat more, eat less, eat better. Then food sensitivity test because you're having symptoms of bloating. You just want to know, what should I be eating that's not causing inflammation, or what is causing inflammation? That'd be actually test number 1. Test number 2 would be that organic acid test to understand if you have candida overgrowth, vitamin deficiencies, different issues with your stomach in general, neurotransmitters, bloating showing up. Organic acid test, good for that. And another one I'd run in conjunction with those 2 is a full lab panel of your hormones and basic blood work and all that stuff too, just to see, is your thyroid off? Is your testosterone, estrogen off? Different things on there.
Thank you for that. Now, honestly, me getting the food sensitivity test and seeing the actual real numbers, that was awesome. It took the guessing out because you no longer have to guess. On that testing, there was foods down there that I've never had or I've had once years ago, and I'm sensitive to it. Get tested, figure out what's going on. Like he said, the food sensitivity tracker, it's free. Start there. Food sensitivity test, the organic acid test, which is the O test, and then get the full lab panel done.
The old MTV commercials, get tested, you owe it to your partner.
How old is that commercial, man?
We got to get into something that a lot of people get tripped up about, and that's integrative health and how it relates to medications. I think that's a big one. People aren't sure. You don't do prescriptions, right? Of course we don't. But the idea out there is that you need to work with an integrative provider. You have to choose between meds or natural remedies. But that's not true. That's not one or the other. You don't have to go with us or conventional medicine. We work in conjunction with conventional medicine, hand in hand. Again, we're not against Western medicine. We are, let's use them in conjunction. You're on an anxiety pill. While you're on that anxiety pill, let's identify the root cause of your anxiety. Maybe you need to rebalance the body for that B complex, and maybe you're on a B complex for a couple months and you no longer need to take the anxiety medication.
Exactly. But there's people out there that assume that you have to be all natural or all pharmaceutical.
No, not at all. And that's why I said, like, even for myself, if there's issues at times where you have to be in front of 1,000 people doing a live podcast, right? Or you're in front of 1,000 people doing some kind of seminar. Same. You're going to have stage fright, anxiety, whatever. Maybe you take a propranolol working with your medical provider and they give you a blood pressure pill that helps keep you calm while you're actually doing speaking engagements. Or do you have issues with anxiety because of trauma and you need to take a Xanax because fireworks are going off and you were in the war before?
Exactly.
So there's things you do need. But on our side is how do we balance your body to help those medications even work better? Or maybe you need to be on depression medication because you have a brain chemical issue. You're on 200 milligrams or whatever each day. And based on working on your nutrition and deficiencies, now you only need 25 milligrams a day and you function better.
And that was gonna be my next question. How well are you able to blend the all natural versus the pharmaceutic? Blending them together, there's a time and a place when it always comes up like that. You might need a Xanax just for a huge crowd. Quite frankly, this is TMI, but anytime when I get super, super nervous, I gotta go to the bathroom.
When I
That's just me keeping it real.
When I was living in Chicago when I was young, that's how it used to be if I have to go to a job interview, if I was going to a nightclub, anything like that, I would be so sick to my stomach, the anxiety, and I don't want to go and this and that. And it's like your body does whatever to try
Mhm.
to get you out of it, right? That fight or flight. So how do you calm that down? Is it therapy? Maybe you need to go to a therapist to understand what trauma you've been through. Why are you having this anxiety? Is it food related? Is it because you're so deficient in stuff that your body's overreacting? Are you stuck in that fight or flight? Maybe we need to address that. And then others, you do have a true medical issue to where you need to be on a pharmaceutical. It's no choice. You have seizures all the time. You need to be on medication, right? You have heart problems. Your heart's not pumping correctly. You need to be on medications. You're on heart medications because of this health condition, heart condition. Now, on the other side, how do you fix your nutrients, your deficiencies to help balance that and let that blood pressure pill absorb properly without high dosages of that pill? Or you hear people all the time on blood pressure medication say they need it because they have heart issues and are on blood pressure medicine, not because of insulin. Like we talked before, is some people have high blood pressure because their insulin's out of whack or their kidneys are off, something like that, to where a medical doctor just says, take a blood pressure pill when it's really not a heart issue. It's an issue with your kidneys or issue with insulin, and that's why your blood pressure is high or too much salt in your diet, whatever. If you were to address those things, you may not need that blood pressure pill,
Correct.
or you may not need 5 blood pressure pills.
Oof.
Because there's so many people I hear, I'm on 4 different blood pressure pills, 3 different blood pressure pills. It's like, why?
Why isn't the first one working? Why do you need to take 2, 3, 4 different stock types to balance your body? And what kind of gut issues is it going to cause you?
Oh, it's causing so many problems. That's why I said, okay, fine, you be on those medications, but how do we support the body to where you're not on such high dosage of those medications? And a lot of people, they get on the proper supplements, proper nutrition, and then you talk to them months down the line and they're off all medications. You saw that even when people did that reboot diet or do all carnivore, you hear them say, oh, I dropped weight, I toned up, I am no longer on my blood pressure pill, I'm no longer on cholesterol pill, and I'm eating meat all the time. And my doctor said that was bad. But you're no longer eating carbs. You're not eating fast food, all that stuff. That was actually the issue. It wasn't that you went all carnivore. It's you eliminated those bad things out of your diet.
Absolutely.
Medications can be powerful tools, like we're saying. They could stabilize symptoms, relieve pain, and even save lives. There's absolutely a time and place for them, right? But we're seeing more and more medications are being overprescribed. Doubtful explanation, right? You go to your doctor, here, take a pill. No, just do it.
Yep.
And that's it. Without a root cause investigation, they do not look. And without a plan to what comes next, just continue taking this pill. So let's take acid reflux as a common example. Patient goes to their doctor, explains their experience in heartburn, and walks out with a proton pump inhibitor, PPI. That can be helpful for short term, right? That's usually like 15 days. Do not take beyond that. But if they stay on it for months or years, it could lead to low stomach acid, which most people have low stomach acid, and they're told they have high stomach acid, which in reality, they really have low. Poor digestion, nutrient deficiencies like B12, magnesium, higher risk of gut infections. No one explained those trade-offs, and more importantly, no one asked. Is this person even eating too fast or under stress? Do they have low stomach acid to begin with? Which is 95% of the issue, is low stomach acid again, not high. Are there food sensitivities or gut issues making things worse? It's one of those things people just don't know.
People are often surprised that symptoms like reflux can come from too little acid. I actually learned about that these past couple of days. If you're having acid reflux, instead of taking a medicine that you buy over the counter, you could be deficient in magnesium. It is awesome to know that when you hear people, oh, I have acid reflux and I can't eat that or I can't eat this because of my acid reflux.
But why do you have it? Are you eating bad all the time? Because you hear a lot of people, oh, I have this. What do you eat all day long?
And not to mention, some people just assume, that the medicine's working just because the symptoms went away.
Yeah.
They're just putting a Band-Aid over the issue for the moment. It's eventually gonna fall off, and if you don't know if under that Band-Aid, that issue grew to a bigger, and now it's the medicine that the doctor gave me is no longer working, and now it's worse. Now I have a serious issue. It's scary.
On the integrative side, we use, for that specific example, we use digestive enzymes, remove those inflammatory foods like gluten or processed oils. We want to improve posture and timing of meals, restore that gut lining. All right, let's look at the organic acid test. Supporting vagus nerve tone to regulate digestion. Same goes for mood related concerns. Someone might be offered SSRI and it might help, but integrative providers would also ask, are you low on magnesium, B6, or how about your omega 3s? How's your gut health? Since most serotonin is made in the gut, which people don't understand. And I know some people feel better on SSRIs, while other ones it's damaging or they cause more problems. So again, as an individual, that's why you have to see what's right for you. But the other one is cortisol dysregulated from chronic stress. Is that your issue? We're not anti-medication. We're pro-context and pro-strategy. Sometimes meds are a bridge. Sometimes they're necessary. But we don't stop at what can reduce symptoms. We also ask, how do we fix the system?
Yeah, I know a few people that have been on, medication for a while, and they'll tell me, "Yeah, you know what? I need to go in there and up my dose." These specific prescriptions were never meant to heal you. They were just, like I said already, put a Band-Aid on things. And once your body starts getting used to that medicine, it's gonna come off. Now I need a higher dose. If there's a way that people could start somehow blending the natural healing with supplements and also trying to, I don't want to say eliminate, but start slowing down on some of those hard medications, your body will rebalance itself out where you no longer may need that.
It all goes, are you deficient in certain nutrients? Is that the cause? Again, people have depression, people have anxiety, people have these medical conditions, and medications can help for that. But sometimes medications will make them worse. In conjunction, like Geraldo's saying, how do we work side by side with your medical provider and your prescriptions you're taking to balance your body and maybe lower your dose or get you off those prescriptions? And maybe you need to be on them for the rest of your life, but how do we balance the body to make you feel even better?
Exactly.
Let's wrap this up by talking about what it actually looks like to work with an integrative health model. This philosophy sounds great, but the practical side is where questions really start. Conventional care is designed to be quick, standardized, and often covered by insurance. That's part of why it runs the way it does. Appointments are usually 10 to 15 minutes, focuses on diagnosis and treatment. It uses narrow set of labels and tools. The insurance billing dictates the framework. This model works for triaging symptoms and managing urgent needs, but that speed comes at a cost. That's rarely a time to explore the root cause of chronic symptoms. Your nutrition, sleep, stress patterns, environmental exposures, or long-term habits, customized whole person protocols, very different than what we do here.
Why isn't it not talked about on how rushed some of these doctor visits feel? They feel rushed. You have little time to talk, and that's it. I know I'm not the only one.
Does it go based on quantity and how much money they can bring in? There's a lot of good ones out there. Like our family practitioner is awesome, sits with you a long time, goes over everything, open-minded, right? Into Ayurveda and all that too. But on the other side, you have a lot of bad medical doctors out there that you're just a number. And let's see how many patients we could squeeze in and how much money we can make today and how many tests we could send them for, how many prescriptions we could get them on so we could make millions and millions of dollars versus what we do. Our focus is helping people heal themselves. That's our goal. And I think that's where we got to get people on track to realize, when is your health important to you and when are you going to step up to the plate and take care of yourself? And a lot of these people, you have family out there. You owe it to your kids, you owe it to your family members to live a long, healthy life.
Exactly. It's for the question that I had asked. Well, not even asked, it's just being rushed. But how are people supposed to get real help when no one's listening for more than 10 minutes? And I know there's some people don't go back to their doctors just because it's the same crap.
Yeah.
Again, they're not heard.
So it's either they're not heard or the information's good enough for them. They don't want to face reality. They want to complain about health issues, but they don't want to face that if there's a real issue. Like you're saying earlier, if I don't go doctor, if I don't run these labs, I'll never have a health issue or I won't know about it until I die.
Exactly.
People got to get out of that mind saying, just say, you know what? I want to live till I'm 85. I want to enjoy my retirement. I want to enjoy just growing up. I want to enjoy life. I want to be successful. How are you going to be successful if you're on 50 pills and you can't walk and you're having all these health issues? You're always in the bathroom. You're always feel sick when you eat. When are you going to step up and say, you know what? I'm tired of feeling this way. What can I do differently? And for us, especially on the integrative health side, the clients that come to us are the people that are tired of going to their medical doctor or they're actually in pain and taking it seriously. Then they come and say, you know what? I never knew about these tests, or I tried everything else. Please help me.
I wonder if it would be different if the actual medical doctors would say, "Hey, we do these tests that your insurance covers, but there's also other companies out if they were to just mention that out there, there's other companies out there that they don't take insurance, you gotta pay for the test, but they could possibly get to the root cause." I feel that almost maybe 90% of the clients would actually go get the full panel done, even if insurance doesn't pay for it, just because they wanna figure out, "Okay, I've been coming to this doctor for years. He gives me medication, it doesn't work, I come back. Let's try a different avenue. Let's see if the doctor that's taking it a step further with integrated health could actually heal me because it was recommended by my actual doctor."
And then we did partner with different physicians out there for that exact reason to say, you know what? Some clients, patients like us may say, I don't want pharmaceutical. I want to look for the root cause. And they say, here's a business card. This is one of our partner companies. Reach out and they could help look for that root cause and run different labs. It's not our specialty.
Exactly. No.
So yeah, integrative care is different than conventional care in almost every way. The time investment is bigger up front because it needs to be. Most appointments for us are 45 to 90 minutes for intake. Follow-ups that actually go beyond checking a box. We're not a 10, 15-minute follow-up. All right, we do 30, 40, 50, 60-minute follow-ups. Detailed health histories, timelines, symptom tracking, right? Do you go to your medical doctor and say, hey, start tracking your food? You never hear that. And long-term is much cheaper. Even if you compare our upfront costs without insurance, it's still cheaper. And we dive much deeper into your health. As you saw with food sensitivity test, you looked at that and thought, man,
I'm still in awe at that. It blew my mind. I wish all my friends, all my family are willing to do this test just to see what's going on.
initially we asked you to complete intake forms that include sleep habits, food patterns, stress levels, and even past trauma and emotional load. Why? Because your body history matters. These things show up and we understand how you got there, got to where you are. But this care is also rarely covered by insurance. That's one of the biggest barriers. People pay out of pocket for consultations, functional lab tests, clinical grade supplements, tools like detox protocols, and gut healing kits. And yes, that financial investment can be significant, but so is the cost of staying unwell. Again, if you can't afford to be healthy, you definitely can't afford to be sick.
That's right. Now, how can people get started if they're on a budget?
Initially, food tracking. Track your food 7, 10 days, see how you're doing, track it longer if you can, and share that data with us if you decide to come to us. And then we could look it over and we may need to just say, you know what, just adjust this for now. Or let's just run that food sensitivity test and adjust your nutrition, and then tell us there, go a month, 2 months, how you feeling? You get better or you're not getting better? Okay, let's run organic acid test. Let's see if it's candida overgrowth. Let's see if it's fungal overgrowth. Let's see if those neurotransmitters are out of whack. Let's see if your hormones are off and go from there, right?
And
Just, it's not expensive when you think about it. Again, it's pretty cheap. How many people eat out? Who can't spend $200, $300 on a test? You have no problem spending $5,000, paying your deductible and co-insurance to run an MRI that's not needed, or a CT scan that now you're exposed to all this radiation. The research is out there. I recall from years and years ago, people running a CT scan, 1 in 37 people develop cancer from a CT scan.
gosh,
So that's very high. But now think if you're running every time you go to a doctor, my stomach hurts. Okay, let's run a CT scan. And you're like, okay, let's run a CT
cool.
scan.
Let's do it
Okay.
again. Yep.
Yep. Now the risk of cancer goes so high. And now you're paying co-insurance. Now you owe a $400 bill for this, $300 bill from this, and it's bacterial overgrowth. We could have looked at that and said, you know what, let's rebalance the body. 2 months from now, you feel fine. So if you do come to any integrative health practitioner or health coach, always stick to a plan at least 3 to 6 months to see how you feel. After, that's when we like to do that survey and say, was it worth it?
Exactly.
I always hear positive things after a couple months.
Yeah, and to me, it just kills me because I know there's people out there spending on Band-Aid solutions that don't work long term.
It doesn't have to be all or nothing. For people just getting started, we always recommend focus on foundations. Clean up your diet, cut processed foods, added sugar, and seed oils. Prioritize sleep, consistent schedule, sleep hygiene, light exposure. Go to bed early. Drink clean water and move your body. Proper water, not fluoride filled sink water. And,
Gross.
just nonstop junk water. Drink quality water, reverse osmosis, stuff like that. Fuji water, those other good brands out there.
Yeah.
Try basic supplements like magnesium, omega-3, vitamin D, and adaptogens, rhodiola, ashwagandha. Track symptoms and start learning patterns. This gets the needle moving while you work towards deeper testing or more advanced support. Food tracking, I always say, is number one and it's free. At least start there. And you could adjust your diet by looking at that. And that's why I said a lot of people can improve just by looking at that, saying, oh, based on my protein, based on my carbs and all this stuff, I'm not eating enough. I don't have proper nutrients here, or it's not enough variety to where I do need a multivitamin. Now, the other thing is talk about mindset because it's just as important as money and time. If you expect a quick fix, you're probably going to get frustrated. Even with your medical doctor, you go for that quick fix. What do they say? Oh, you're having anxiety, you're having this, you're having stomach issues. Take this for 6 weeks, 12 weeks, whatever the doctor tells you to get those blood levels up before you feel any different. But you're still getting frustrated because it's not a fix overnight. If you're used to taking a pill and getting immediate relief, right? You have gas, you take Gas X, you feel better. You're still not looking at that root. But if you're ready to be curious, consistent, and patient, you'll see lasting change. Integrated health isn't about fixing you. It's about teaching you how to work with your body, not against it. It requires experimentation, journaling, adjusting, and showing up consistently, even when it's slow.
Honestly, it's all about the mindset, how it plays a huge role in whether someone succeeds in all this. You got to have an open mind. You got to be thinking positive. I came in it not knowing anything, and I am grateful for everything that you've taught me, everything that I've learned, everything that you and I have both shared together. But it's just one of the biggest things for me is the consistency of taking the supplements at a certain time. Every day at 9 o'clock, that's when I take them. When we first started all this, it was hard for me. But now, once I started realizing this is actually working, this works for me, let's do it. And I haven't stopped since.
We see so many people that try it and quit after a couple of days. And I understand it just sucks taking pills. Maybe powder works better. That's why I tell a lot of people. People like, I don't like taking capsules or I don't swallow pills. Have a protein shake in the morning or some kind of shake or vitamin nutrient shake that has all the supplements in it, or having a fruit smoothie. Open up those capsules and dump it into your fruit smoothie. You won't taste it, mix it well, and now you took all your vitamins.
Exactly. Now, for people, what should they expect in terms of a timeline and how they know it's working?
Usually, based on symptoms, you'll know usually it's working. You're starting to feel better, more energy, less bloating. And usually that 3-month time frame. That's why we say 3 to 6 month commitment usually, because a one-time meeting is not going to help your body rebalance. It's too short of a time. There's not enough adjustment there. And if you need to adjust your supplement routine, we can't do it with just one consultation. That's why we say, you know what, do maybe 3 months, 6 months of consultations to where we do initial intake, understand what's going on, then maybe run labs and then see, okay, these are the required, the recommended supplements. Let's use these in 30 days. Let's have a call, understand how you're feeling. Okay, you may be feeling fine on the right track. Okay, we'll talk again in 30 days. Keep journaling because we don't want to introduce too much. Maybe after 30 days, we say, you know what, based on what the bottle says, start taking 2 capsules. Let's see how you feel. And we may need to adjust and we may get to that point where you've been on B complex for 3 months and you feel so much better and your levels are better. You run different labs and say, you know what, you no longer need that B complex. You no longer need that zinc because you're getting it from your multivitamin. Now your levels are up, or you're eating proper nutrition to where you no longer need a certain amount of supplements. Supplements aren't forever either.
By then, if you get to a high level of supplementation, and then your body's going to change, your energy's going to change, your mood's going to change. Once you start doing that, you yourself doing your own research and saying, okay, these foods are better for me. So then next thing you know, when it comes to reducing or lowering the dosage, just because you're getting it from a different source, which is awesome. Don't get me wrong. But I'm sitting here thinking to myself, and I know doctors are successful and whatnot in the medical field, and I know they'll see less patients if they took and invested the same time that we are in making plans for people the way that we do, like how much more successful they can be, but literally have one of those turnabout doors. One comes in, one comes out, one comes in, one comes out. And for us, we're actually tailoring a whole system for them, for an individual that needs it.
We want to help people heal. That's business, big business. And more people, once you're on pharmaceuticals, now guess what? You need to come back or they're not doing a refill. You know what? You don't have to deal with that on a supplement side. And I always think, even for prepping, emergencies, it gets bad out there. How are you going to go to a pharmacy? You could only get your prescription for so long, like we did on that prepping podcast. Oh, on a supplement base, what's the natural way you could do it? And you could buy supplements. You could stock up. You could have all these things there. So you can't get Xanax. You know what? Maybe B complex works just as good for you. And you know what? Maybe you have 10 bottles sitting in your basement or cold storage area. So emergency happens, you don't have nothing to worry about. But it's one of those things. It's all about education. And we could get a whole bunch of clients a day. But our goal is we want to have long consultations. 139 for consultation, that's 45 minutes, an hour long, versus you going to your medical. We like to have those long consultations that could go 45 minutes, 60 minutes long and actually understand what a client's going through versus how many patients does a medical doctor see within that 10 minutes, 10 minutes, 10 minutes. And then each one comes with a prescription and now you have to come back. That's not what we do, right? Again, we're here faith-based. We're here to help people heal, and what comes around goes around kind of thing.
Right.
But yeah, as we start to wrap things up, I hope this helps see that medical care is crucial. It's very crucial, but it's not the full picture. If you want to feel better long-term, you need more than symptom management. You need a strategy. That's where integrative health truly makes a difference. So here's the bottom line. Integrative health and conventional medicine aren't enemies. They're designed for different things. If you're in an emergency, go to the ER. If you're dealing with fatigue, brain fog, gut issues, hormone swings, or autoimmunity, you need a deeper lens to look into that. It's not about choosing one or the other. It's about knowing when and how to use each approach. If you want to explore this further, check out our functional lab options, supplement store, and custom coaching at mindfulobjective.com. We also have 20% off clinical grade supplements for our podcast listeners. Just go to that mindfulobjective.com. Once you get to the website, you'll see 20% off, or you could click on mindfulobjective.com/supplements. Go there, sign up, and you're free to take advantage of our discount. Again, you don't have to be a client of Mindful Objective, but you do have to create an account to get our discount. And then you're free to order any healthcare products or supplements, toothpaste, hand cream, face lotion, all vetted products out there that don't have a lot of these junk fillers out.
Clean products. And this episode definitely cleared up a lot of questions, a lot of things that I've been wondering, but I hope it helps someone listening realizing they're not crazy for wanting more than just taking a pill. We will see you in the next one.
Again, this podcast for information and education purposes only. We do not diagnose, cure, or treat any illness or disease. As we always say, ask the right questions and know we are here to help. Even if you do have a general question, doesn't mean you have to be a client. You can feel free to send us a general question and we'll point you in the right direction. We do offer free 15-minute consultations just to point you in the right direction. And we're thinking about doing some free 20-minute consultations just to get you in the right direction for the month of July. So if you are interested, you want to reach out, have a quick 20-minute call to discuss your health issues, you fill out the intake form, go over that, and then we'll point you in the right direction, maybe what supplements you may need or what tests you need to run. And additionally, we thought, based on those free consultations, we will do a discount on the follow-up consultation. And again, this is just to help people heal. We know there's a lot of people that are sick out there. And the reason we're doing this is we're seeing more and more clients. We're talking to more and more people that are really struggling. We're just here to help. As always, ask the right questions, and we're here for you. Stay well.